Hi, I'm Matt Rose and you're with Wigwith. Please like, share, and subscribe to my videos. Today is Monday, August 17th, 2020. I want to give some background info on the orthopedic surgical center that the UCP government is planning. The $200 million private clinic, which if approved would be the preliminary design for the 270,000 square feet, either 5 or 7 floors. You know, it's pretty much been kind of pushed through in a way that like AHS is going to have to approve it. So there's a guy named by the name of Ivan Bernardo. Apparently he's a senior staff member of Tyler Shandro. He's been kind of working with the whole, canceling everything for the local public healthcare system. So, if he's kind of clearing the road for this private clinic, it's really bad news. What we're seeing here is a real disregard of everything that, public healthcare is supposed to stand for. And, as a Canadian, I really appreciate my public health care. Like it's not perfect and it's definitely underfunded. It lets you down sometimes because of that fact, but this is on purpose as we've seen. And, it's going to just be worse in the next couple months because we're going to see all of these things start to come together that the UCP's been planning. So, this healthcare facility, it's going to be a privately run facility with surgeries running 23 hours a day, up to 10,000 surgeries, all non-union employees. So, like major kickbacks on the owners and whoever's like an investor because they don't have to pay those union fees, which is really just kind of why these lobbyist groups go right to the UCP government, um, and then Chandro is kind of working with the lobbyist group in this situation, which kind of presents even like conflict of interest because they are definitely probably going to be investing in their own properties, right? It's kind of something that the backdoor deal would have in mind. That CBC's kind of had this whole conversation tape recorded. I was hoping that that would come out or something more would come out about that before today. I've taken a few days to wait on this video, but I really want to just go over this. And then one big thing that really just draws this all together, though, is the opioid crisis going on right now. Is we've seen massive amounts of deaths on our streets in the last couple months due to opioid crisis rather than COVID. We've been fighting this virus, and good for everybody for adopting wearing masks and sanitizing everything. It's been a tough battle, but at least we've kind of got that under control. But what's really been rampant is the opiates. Like people are dying left and right from overdose during lockdown, and that's just not right. That's our healthcare system failing just 100%. And one big thing that also came to light today is that Tyler Shandro has cut $6 billion from public health care over the course of the since they've came to power, and that is also just insane because we are seeing public health care in 400 different clinics either thinking about closing or having to lose staff. So our healthcare system is hurting right now and people are dying, and the opiate crisis is just the tip of the iceberg. Like the UCP doesn't want to release files on the stats from the last few months because they know it's going to make them look way worse. But I saw a really bad meme for BC, and their opiate crisis looked like about 10 times worse than the COVID deaths. So, we really got to look at our healthcare system. And if we're cutting $6 billion in a pandemic while we're seeing like a huge wave in deaths in whether it's just that category or whether it's across the board, like I suspect there's a lot more other people that have died over the last few months due to lack of care. So I really think that we need to, look more into this and start asking these people, like, what their plans are, you know. David Shepard called this project Special Access to Friends of the UCP. He's asking the Auditor General to look into it. Elon McDonald claimed that Ivan Bernardo was appointed to work on a file and clear a path for this project. And this project circumvents all normal checks and balances. So a small group of people are going to privately run this clinic and profit off it, and then we're all going to pay for it, and that's going to be public money going into private healthcare, and meanwhile we're all dying. So that's not right, and the UCP government should know this by now, and they do, and this is on purpose, and they have no majority with me. I hope that you guys feel the same. I'm Matt Rose. You've been with Wig With. Please like, share, and subscribe. Thank you. Bye.